which ones just carry it, which is no big deal, or which ones don't have it at all. So we can avoid genetic disease. Same thing with sickle cell anemia. Like a black couple, typically, it doesn't have to be black. If they carry the wife or the woman carries sickle cell anemia, and a man carries sickle cell anemia, we can help them have a child without sickle cell anemia and avoid suffering in that child. And we can do this for all genetic disorders. So it's really cool. We can test the embryos before we put them back into the body, before they're a true baby by definition. We can avoid genetic disease. Now, where it's going to get really controversial is here in about 10 or 20 years, we can go in and edit that out with CRISPR and other gene editing tools. What's your question about that?
So when do you consider it a true baby?
It's a very good question. And there's actually definitions to it. And Dr. Howard Jones, that old man that we saw, he actually published this. These were brilliant Johns Hopkins physicians that eventually came to Norfolk and had the first IVF baby. And it's a complicated definition, and everyone's got a little different definition. Everyone wants to have a different definition on life. But basically, it's when you see a heartbeat, which is 6 weeks, 2 days. But not all the time. I consider it at fertilization. And for me, everyone's got a different definition. Like for me, it's when the egg and sperm come together. I call that life. Now, Dr. Howard Jones, the expert, he made a good argument. He said, well, and this is a big time argument, of course. Roe versus Wade, blah, blah, blah. And this is a big, deep answer. But they showed scientifically, objectively, trying to define when does life begin. He said, with fairly good certainty, when you see the heartbeat, it's 6 weeks. Really, it's only 2 weeks old, because they're going from a last menstrual period, but really the woman's only 2 weeks pregnant, when we call it 4 weeks pregnant for when we call and the argument is, earlier than that, you can get an abnormal pregnancy called a molar pregnancy, which is a cancer pregnancy that's not really a human, it's a tumor. So there's a lot of arguments that you can still have egg and sperm come together and develop into something odd, not a life. So in the medical definition, they would say once you have a heartbeat, they would call that a life. And that's really at 4 weeks, or like 28 days after conception. But the way we do it at OBGYN, we call that 6 weeks, but it's really 4 weeks of development. That's when we would call it life. But I like to call it back when the egg and sperm. We give them all respect. I consider an egg and a sperm to fertilize, I call that life. And syncopy, that really cool picture we saw a while ago, that's what I call it life. But I will admit, there's some other weird forms of life that aren't really a life, that are cancer. There's a cancer pregnancy called a molar pregnancy. There's trophoblastic tumors that it's where an egg and sperm came together and became a tumor, not a human. So it gets controversial, for sure, but I'm glad you asked the question. Most would say 6 weeks or less. Yeah, question in the back.
If the embryo has been implanted, and there's a heartbeat, who knows that, I mean, you can't hear it, right? I mean, we're talking about just a few cells, right?
Well, before we put it in the body, it's at 64 cells and there's no heart.
Right.
There's no blood vessels. There's no coursing blood. There's no brain. But it's alive. These are cells that are growing and dividing and folding and becoming structures, which I'm going to show you in a minute. I still call it life, but is it a human life? You know, there's a lot of debate there. But when they're frozen, they're 32 cells. It's really a ball. And where it gets controversial is, let's say the woman has 10 frozen embryos. We know that it's kind of a biology thing where, how do I say this? Most of our embryos are genetically abnormal. As humans, we're the worst, compared to other animals like squirrels or horses. And when a horse egg and a horse sperm get together and make a horse embryo, man, if it gets near a horseshoers, it's going to be a horse. It's really good. Like with 95% efficiency, it's going to tank. As humans, we're the worst. In the whole animal kingdom, we're reproductively, we're the most inefficient. When our egg and sperm come together, the genetic material gets screwed up in more than 70% of our embryos on average for young women. And that's why older women don't get pregnant. Well, so we have this beautiful egg, and I'm amazed that we have the pregnancy rates we have saying this. But when that egg and sperm come together and starts dividing, that first separation of genetic material is really sloppy. And then it's bad. It's like the blueprint's bad. Like you're trying to build a house and the blueprint's scrambled. And what's unique is it grows for a while and we'll take it to the point where we put it back into the uterus and then it just falls apart because the blueprint was bad. So we don't know exactly which ones are going to be the baby, the healthy baby, and which ones are going to be the one that just doesn't take and falls apart. And that's what a miscarriage is also typically. That's where the genetic material scramble. One will make a life. Can't make it. It would never make it. Except in trisomy Down syndrome, trisomy 21, they can. There's a few of them that can make it to life, but most of them can't. So those can't say that all the frozen embryos are going to be a baby, but we respect each one as if they're going to be a baby. Your question back to that?
Yeah, I'm sorry, but when you fertilize an egg, are you selecting a sperm to fertilize, or are you presenting sperm and one of them takes?
Good question. We're taught scientifically to sift through and find the one that Josephine makes for us. She sifts through and finds the prettiest one that looks the most normal, and they punch the normal one into the egg.
So you look for the good swimmer?
Yes.
Okay.
But you don't have to. There's a lot of science. You can just take one that doesn't have a tail. You can take an ugly one, and it's just as good as a pretty one. But scientifically, our scientific staff, they'll find the pretty one, put the pretty one in the egg, and give every egg a chance. It's a good question. There's a lot that goes deeper than that. I like the question. And there was another question in the back.
Yeah, I was wondering, why do you think it is that humans have the most problems with reproduction?
It's a very good question. So why are humans so bad? When our egg and sperm come together, man, why do we make so many bad embryos, and why, we know the perfect situation, a 21-year-old woman and a 21-year-old man, and she ovulates and sperm gets to that egg, at best it's a 20% chance she's going to get pregnant that month. Isn't that amazing? Of course, I tell my daughter it's 100%. But I don't know the answer to that. It's a very good question, and I really don't have an answer for that. Like sheep and pigs and other mammals do way better than us. And Josephine, I don't know if you have an answer to that.
I'm trying to Google which has the most number of chromosomes. Does it have anything with the
Well,
number of
strawberries had the most chromosomes. That's not a mammal. I don't know. I don't think as a human, I don't think we have the most chromosomes. But it might be something like that. The answer might be that we have a lot of chromosomes and there's more room for error. So if we have 46 chromosomes that have been, and you have an animal that's got 30 chromosomes, maybe it's less chance for error. I'm sure there's theories and hypotheses out there for that. It's a very good question.
So when you look at fertility issues, do you often present that as environmental? Like if it's an issue with the male, that it's environmental or dietary or something?
It's a good question. There are certain toxins that are bad in regard to gains, like egg production and sperm production, especially when the woman was developing eggs when she was in utero with her mother. That's when she develops her eggs. Men generate sperm all their lives. Like in men, lead is bad. And there's a few others. There's a few others. There we go. So there are toxins that are embryo toxic that kill that embryo, and potentially could lead to birth defects. You're exactly right. I don't know if I answered that question properly.
No, that was good.
But alcohol's bad. There's different reasons for bad. Like caffeine makes it not implant as well. Like it affects the uterus. And alcohol makes it not develop. We don't know exactly why a lot of these toxins are bad, but yeah, they're not that good. Question in the back.
A couple, with human fertility, has the numbers increased through the years, decreased, or they have about the
It's a
same?
very good question. So the question is, has infertility increased over the years? And it sort of has, but my take on it is it hasn't really. It's really been the same. It's just there's less stigma involved. I think people are not as embarrassed about it, and it's cheaper than it used to be. Like it used to be, it was either embarrassing or too expensive. Or remember that, I'm old, I remember back in the day before IVF, it was, the couple had infertility and they didn't really know why. Now we know why people, we understand a lot better why people don't get pregnant. I think we have better tools to diagnose it now, and we have better ways to treat it. So it's 1 out of 8 couples. So some would argue 10% of all couples have infertility by definition. It's a lot of people. I don't think the number has gone up. I think it's better defined and treated, and more people are seeking out treatment because there is treatment. That's my take on it. It's a very good question.
Second question, is it hereditary?
Is it hereditary? Usually not. But there are certain things that are hereditary, like if a woman has endometriosis, her daughter has a 70% chance of having endometriosis that can lead to infertility. So, and there's something called polycystic ovarian syndrome, which is another form of infertility that can be genetic also. But just having your tubes blocked is not hereditary. Just having, usually with sperm problems, it's not hereditary, but it can be. But I think the majority is not. Okay, that's also an excellent question. Okay, so one of the questions, are humans fish? So, as we're developing, as we go from 1 cell to 2 cells to 4 cells to 8 cells to 16 cells, 30, we're putting it back in the body at 32 cells. The body keeps developing, eventually become millions and millions of cells. There's folding of this structure. There's, we call them analogous structures. Like we can see like a human and a mouse. There'll be similar things, like a fish, a zebrafish might have an intestine, and humans and chickens have intestines too. But we don't really have gills. Like we eventually, as humans, we don't really have gills, but we have these folds. And some people call folds gills, and they're not really gills. So it's not. So that was one of your questions. As we go through phytogeny, or as you embryo development, we can have like a structure and say it's similar to a fish's structure, but we really don't become a fish first before we become like a human. I mean, I understand why they describe it that way, but you don't really become a fish before you become a human. I think that's a myth. Yeah, question.
Didn't that all start out not from observation, but from suspicion that a doctor just kind of drew what he thought the different embryonic
I believe that. I think, back in the day before we knew all this stuff, to the level we know it now, there was a lot of speculation, and it might look like a fish, and they would make they'd surmise these answers that probably led to some of that thinking in the myth development. Question in the back. I like that.
This might seem silly, but like, at any point, does the fetus or embryo grow a tail? Or has that ever happened?
Well, it's called, sort of.
Sort of.
And I don't know if you call it a tail. It depends on the caudal extension of the spinal column, and you have small legs. It can kind of look like a tail, but I don't think you can wag it. Well, maybe you could wag it. So we're not a dog, though. That's where people make that stretch. Like, oh, you're a dog first before you become a human. So there's analogous structures just from the caudal extension of the notochord. And a dog will have that same thing, but then theirs continues to grow and actually has vertebrae. So there is some similarities in, we call it ontogeny, or as you're developing. But we're not like a fish or a dog first. A fish is a fish, a human is a human. Yeah. And we have some similarities, but you don't go through one to become the other. That's it, yeah, good way to say it. This is just a picture of when we have an embryo. We're holding it. This is a vacuum. We're holding an embryo, and they're going to put a hole in that shell, and they're going to pluck a cell out without killing the embryo. And that cell they pluck out, they send it off, and they can tell us if it's good or bad genetically, or if it's got a problem like carries sickle cell anemia, and it doesn't kill anything. Yeah. Yes, question?
What sort of genetic stuff do you test for?
Any genetic, pretty much any genetic abnormality that we're suspicious of. And the ones that were really common, that are common these days, there's 5 big ones. There's cystic fibrosis. You see that more in white people of Northern European origin. Sickle cell anemia, you see more in African American people. There's something called thalassemia, which you see in those of Mediterranean origin, like Italians or African, even Africans. Or if you're an Indian, there's thalassemia in Jews. You see Tay-Sachs disease. And these are childhood genetic diseases. Those are the main ones we're screening for, is known childhood genetic diseases. And it's a great question. Now we're getting to the stage, which is controversial, where we can test that embryo for adult genetic diseases, like adult onset dementia. Like let's say you have a grandparent that has this genetic problem where they get demented, their brain goes bad after age 60, and not the normal age of it going bad at 90. Well, now it's kind of an ethical and moral dilemma. Do we test the embryos for adult diseases, or should it just be childhood diseases? So we're kind of in that phase. And we're even in a weird phase where they're trying to force on us to screen for the grandchildren. Like if they have a certain genetic problem, like Fragile X, we can test the embryo and we can tell you it's not going to happen in that boy or girl, but it could be their grandchildren, the next generation. So should we be testing embryos for the next 2 generations away? And so we have to deal with a lot of moral and ethical problems like this. And right now we're mainly after childhood genetic diseases, but we're about to do more and more adult genetic diseases to try to avoid them. Yes, question?
What happens if the embryos are tested positive or for whatever you're testing? What do you do with them?
They're usually not used. That's a moral and ethical dilemma with this.